session. I have questions for this YouTube beforehand only. I had a lot of questions on WhatsApp and my Facebook. So I'll start answering those questions if there are no questions live today on WhatsApp, on my YouTube. So there were few questions which I would like to answer. I hope the students join in very fast so that we don't waste time. One of the question was, somebody had asked me about the indications of Brata self and why a Brata self is indicated. Some have asked me something in regarding the use of nosodes, especially the COVID-19 nosode, and few cases which have come on my new WhatsApp group, the fourth group. There are about 16 cases, so all case I will not be able to discuss because there are so many cases and very difficult to discuss every case. So welcome, good afternoon, Dr. Bilawalkar, Dr. Babal, Dr. Anja Smith. So regarding Brata self, I think the doctor is still not on the line, but still I'll start answering some of the questions which are there on my WhatsApp. The first was regarding one symptom where it was a very interesting question also, that sometimes the tongue feels, the mouth feels so dry that the tongue adheres to the hard palate. This was a very interesting question, and the doctor said that he had already given Nux mosquita and other remedies, but it was not working. Remember, the dryness always is not related to Nux mosquita. There are a lot of other remedies that you should think about. So first of all, before jumping into remedies and before just repetizing symptoms, first understand if there is any other pathology involved in the case, whether the patient is suffering from, for example, diabetes mellitus. When the sugar goes very haywire, very hysterical, there is a lot of dryness in the palate and the hard palate and the mouth, and the patient starts drinking a lot of water. Also, in case of hypothyroidism, this is the complaint. So first make sure, is it primary disease or it is secondary to something else. If it is not related to anything and it is basically a constitutional symptom, then you can think about 3-4 remedies. Of course, Nux mosquita is a very interesting remedy. Do think about bryonia. See, simple remedies, bryonia, belladonna, argentum, causticum are very important. But in bryonia, it is very interesting that, I don't know, a lot of people forget bryonia for dryness. But it is a very important remedy. Everything is dry in bryonia. As we have already learnt in a college that bry is dry. The dryness of mucous membrane, the dryness of thoughts, the dryness of hair, the dryness of skin, everything is dryness. And why it is important? If you open bryonia in Mater Medica, the elements from in bryonia are very close to Staphylococcus aureus. Elements from chagrin, elements from mortification, elements from anger. This is a very important indication of bryonia. And in bryonia, very important symptom. Hello, Dr. Anja, Amit, Renu, Vishek, Ritu, Dr. Gopal. I was just telling something about bryonia. That's why the thirst of bryonia is important. Thirst for large quantity of cold water at long intervals. And bryonia patient basically a very irritable patient, inclined to be angry, inclined to be vehement. And then you have like firm muscular fibers and nervous and slender pupils like Nux vomica. So this is an important symptom of bryonia, dryness. So this is what I was telling you about the dryness of the mouth, the tongue adheres to the palate. Don't always think about Nux mosquita or other drugs, because bryonia is a very important drug. Think of belladonna, think of alumina also is very important. Can we think about Brata self? The doctor still not arrived. Okay. Next question was regarding throat complaints, and one of the questions regarding throat complaints was that now one doctor had asked me something about there are tonsils and there are deposits in the tonsils. These are called as basically caseous deposits in the tonsils. CASEOUS. You can have the pus deposits, or like pus like or white discharge or cheesy material on the tonsils, and that a very important symptom, tonsillitis. It is said that when the patient opens the mouth and there is a lot of bad odor, fetid odor, putrid odor from the mouth because of that accumulation of that caseous matter or pus in the tonsils, in the tonsil crypts, one remedy you should always think about: Don't always think about Brata, but do think about a very, very important remedy, and that is Sorinum. Sorinum is a very, very important remedy where you can see the caseous deposits in the tonsils. In fact, I had a case where there was stone deposits in the tonsils when the patient used to cough and hawk, and immediately the stone-like discharge used to come out on the hand, and it was very offensive. He came to me, and on the first instance, I prescribed the patient Sorinum, and after that remedy, he did not require any dose of Sorinum repeatedly. This is a very, very interesting and a very, very important indication of Sorinum that you should always remember. Of course, Sorinum patient, basically remember one thing, is a very hopeless patient. Always there is despair of recovery when he's sick. A Sorinum patient will come and tell you, I have this problem since years. I have never recovered. I don't know whether I'll recover or not. He is very hopeless. And that's why he has a lot of suicidal thoughts. That is Sorinum. So do think about Sorinum when there's some caseous deposit in the tonsils. Of course, one more remedy which is very rare, I think I've told you in my previous webinars also. That remedy is rare, but a very, very important remedy in case where there is caseous deposits in the tonsils. That remedy basically is more indicated for other complaints, but we basically forget that indication of that remedy, and that is Chenopodium. Chenopodium also has a very, very important indication of caseous deposits or stone-like deposits on the tonsils. And when the patient opens the mouth, you examine the tonsils, you examine the mouth, and you can see some white cheesy matter on the tonsils. Don't always prescribe Hepar sulf. It's a routine procedure because there is pus-like discharge there. Think about some symptoms which are very, very important and rare in this type of complaints. Of course, Chenopodium is a very, very important remedy for urinary complaints where there is the urine is copious, yellow, and there is a very acrid sensation in the urethra, pricking sense in the urethra, and that is a very, very important indication of Chenopodium. And Chenopodium is a very, very interesting and a very, very important remedy for ear complaints where it is written that the patient has deafness to sound of the voices as passing vehicles, and also that low tones are not able to hear, and the patient suffers from oral vertigo, AURAL, oral vertigo, a very, very important indication of Chenopodium. And a very, very important three marking symptom, striking feature of Chenopodium that I've seen in many of patients is there is intense pain between the right shoulder blade near the spine. Right shoulder blade near the spine, there is a lot of pain. That is a very, very interesting and an important indication of Chenopodium. So these are the two remedies which you should think about when the patient complains. Of course, there are other remedies like magnesium is there, Hepar sulf is also there, Calimure is also there, but Sorinum and Chenopodium, these are very, very important remedies for caseous deposits in the tonsils or pus sometimes in tonsils. It gives a very, very good results. So can we have some questions, or I can go further in this? Any other questions, or I can start? Few questions are on the WhatsApp. Yeah, so I have a question on WhatsApp. If you, this is the WhatsApp. So there was again one of the case, Dr. Vaishnav, good afternoon. So there was one case where the patient has told that whenever a patient tells you something, a striking symptom that you have to always, if you don't feel that you know the remedy, agar aapko remedy pata nahi hai, write down on the paper. Maybe in future you can have, and you can always have these type of symptoms. Dr. Sahil, sir, you are, oh, thank you so much. So there was once a symptom when the patient came in and told me that whenever he is drinking water, there's a lot of constriction. मतलब जब भी मैं पानी पीता हूँ सर ऐसे चोक हो जाता पूरा. And whenever you have this symptom of choking, choking, पूरा गला चोक हो जाता पानी पीने के टाइम पे, हम हमेशा सोचते हैं, we always think about one of the snakes, lachesis and all, but it is not there. Whenever the patient tells you there is a lot of choking when he's drinking water, think about the remedy that is natrum mure. Choking, choking of thoughts, brooding, lot of thinking. He cannot think beyond that. So that choking of mind is seen in the body of the natrum mure patient also. Choking is a very, very important symptom while drinking of natrum mure. Then, as a homeopathic doctor, Ask the patient whether the choking is better by warm drinks or the choking is aggravated by cold drinks. And then you can say whether the choking is only because of water or the choking is because of drinking soup or maybe any fruit juice or drinks. So if you differentiate between normal drink, water, warm fluids, uh, hot fluids, and then you are able to differentiate the different remedies. Like we have calibrom, we have calcarea floor, we have belladonna, we have natramuse, stramonium, sumbul. They all have choking while drinking, but then it differentiates. One is better by drinking hot water, one is aggravated by drinking fruits and soups, one is aggravated by drinking simple water. These are the complaints. Sometimes if the patient comes and tells you there is choking only while eating, मतलब water का part हो गया, when there is choking while eating, then you must think about lachesis. Choking while eating is a very, very important symptom of lachesis and phytoleca. Now, lachesis, I hope that you everybody know, and phytoleca, which I am talking about, is Phytoleca decandra. And whenever you want to prescribe phytoleca, it is a very, very important remedy of patient with rheumatic diathesis, especially rheumatism of fibrous and the periosteal tissue. Syphilitic case, periosteal tissue, हड्डी पूरी घस गई, patient चल नहीं सकता है, the patient is not able to walk, there is a lot of degeneration, there is a lot of aging process, then you must think about Phytoleca decandra. Rheumatic diathesis, rheumatism of fibrous and periosteal tissues. And in Phytoleca decandra, there is great exhaustion and profound prostration. So when there is a lot of prostration, don't always think about acids, And it is very, very beautiful written in a Mathematica that it occupies a position between bryonia and rustox. Cures when these remedy fails when they are apparently indicated. Do you get me? Sometimes for maybe arthritis or periosteal problem or fibrous tissue or rheumatism complaints, we think about bryonia and rustox and the patient improves but comes back again. Patient improves but comes back again to the same, and then we change the potency, we again retake the case with an intercurrent remedy, does not work. Do think about Phytoleca decandra. It is written, it occupies a position between bryonia and rustox. So this is again, afterwards you can think about symptoms like this, the symptoms of Phytoleca is like pains are flying, like electric shocks and shooting pain and shifting pain. These are theirs. But this symptom of Phytoleca between bryonia and rustox is a very, very important symptom. And of course, then we have symptoms of the breast, the fibroadenoma symptom, the lump symptoms. These are all symptoms of Phytoleca decandra. But I have seen Phytoleca working when there's a lot of choking while eating, especially in cases where the patient comes with upper respiratory infection and the patient says that whenever I'm drinking water, or sometimes eating, there's a lot of choking, so I cannot eat and the pain goes to the ear. Then it becomes a very, very important symptom of Phytoleca decandra. Okay. Next symptom, next question on the WhatsApp. I'll just. Okay. So do we have some symptoms live or I'll be only on WhatsApp? Yeah, good afternoon, Dr. Sasdev. Some live questions so that if everybody knows what is the question and I can answer. Otherwise, I am only speaking for 1 hour. It's like that. Anybody? So if there are no questions, we can still go further. And again, are there any questions? I think everybody's understood homeopathy very well. So one more question was there there are a lot of questions asked me before the YouTube and the live, that whenever there's a lot of anxiety in the stomach, whenever there's a lot of anxiety, the patient feels, now this is a very, okay, we have a question. So I'll answer. 84 years patient, fingertips numbness, tingling heat, warmth, aggravation, like washing hands, touching sheet, warms, burning pain, holding the newsletter is painful, hands are dry, warm, rubbing fingers, emulation. Yeah, so there are 2-3 things which are very, very important in this case, First of all, if this may be a problem with the neuropathy, If there is peripheral neuropathy, so these are the symptoms basically of neuropathy. first of all. Second, patient is 84 years of age. So basically, if you're not getting a classical case taking, make sure that at the 84 years, you can relieve some symptoms if you give some acute medicines. Okay, neuropathy is the cause if the patient is suffering from a primary disease, diabetes or blood pressure, or maybe the nourishment, the B12 is not there, or the patient has been not taking food properly also, then there is a problem. So in this case, basically, just rubbing the hands ameliorates because it creates heat, so that is also problem. So whenever if you get case, especially old age, and the patient is better by rubbing, so do ask 2 or 3 things whether the patient is better by rubbing gently. If the patient is just better by rubbing gently, then there are few remedies which are again very, very useful. You must think about formalin, lysine, and diascoria. Generally speaking, if the patient is better by rubbing, it's like better by rubbing, you must think about remedies. The constitutional, it's written that constitutional chili patient, a very important remedy is Kaliars. Second remedy you should think about is arsenic. Third remedy you should think about is nitric acid. And fourth remedy you should think about is carbolic acid. If the patient is better by rubbing it very hard, then think about rustox and radium brome. So these are different symptoms you have to ask to the patient, and it can be a symptom of neuropathy also. Dementia after taking psychic treatment and sleeping pills for 9 to 10 years. Now the nerves of brains are shrunken. Yeah. So this is a very, very common problem that we face in our practice. The patient comes with a patient with depression or schizophrenia or bipolar disorders. He has been already taking so many antipsychotic medicines and like haloperidol and clonazepam and serotonin uptake inhibitors and acid dopamine and noradrenaline. So they have been drugged so much that they start gaining weight, they start eating too much, become very drowsy, become very sleepy. In this case, it is very important of what I do in my practice. Do a proper case taking, what the patient was there before when he was taking a lot of medicines. Of course, you can basically start your treatment by either you have nosodes or sarcodes, what the patient has been using in his practice, in his treatment. You can give that remedy as an integrant to open up the case, and then take up the whole case, because in this case Nux vomica might not help, because we have remedies like that have been made by haloperidol and a lot of allopathy medicines. We call it tautopathy, and you can give that as a remedy to open up the case or to remove the side effects of that, and then take the whole case of the patient, repertorize the case, and just select 1 or 2 or 3 very striking, peculiar, uncommon symptom in relation to the patient. Because he has taken so many antipsychotic medicines, it is very difficult to understand whether this symptom is a symptom of the patient or this symptom is because of giving lot of allopathy medicines, because of which the patient can suffer symptoms also. So it is basically an art to interpret what is the patient's state and try to interpret the patient's symptom, and then we are able to prescribe the similar. In this case, I use LM potency in repetition, because in this it requires a lot of repetition. If you don't have LM potency, you can start with a high potency 1M 10M, because the patient has been drugged and the patient has been diseased to the soul of the patient. The soul has been it is in a deep seated cases. So you have to touch that part of the body, the soul of the body, so that you can get some relief to the patient. How to treat osteoarthritis of knee where surgery is suggested. See what happens if the patient is, if you look at the patient, he has osteoarthritis and there is bowing of legs. The legs have been bowed. Like if this is your legs and osteoarthritis here, and the legs have become like this, bowing of legs, like this, and the patient walks like this, and this bowing keeps on continuing, and that's why what happens, you cannot straighten up the bone. So that's why the pressure in that bone keeps on increasing. In this case, it is very important that we can stop the progress of disease. That is very important, used to stop the progress of the disease and give the patient some what you call kneecap, so that the knees become firm and stiff. It does not get a lot of bowing, but because once the bowing starts, and the patient starts walking like a penguin, it is very difficult to cure these type of cases. But still, you can give symptomatic relief also, and you can modify the disease. The remedies which basically I use in my practice are, of course, calcarea is there, silicia is there, moxol is also there. But there are some remedies which basically I use in practice. First, I would say cod liver oil has given me very good results in these type of cases. Second, I would say Kali iode, a very interesting syphilitic remedies when the bones are involved. There's a lot of degeneration, there's a lot of osteoarthritis, Kali iode. And third remedy that you should always think about is ferrum iode. These two or three very rare remedies have given me very good results in my practice. Okay. Yeah, so whenever I'm giving you some answers and you're applying that answers in your practice, and if you get good results with that, do share your experience so that I also know that whatever I am trying to convey you is basically working in your practice and you are improving in your practice. So it's basically a very important learning experience for me also and for you also, that we can grow together in a practice. Okay, so do share your results also. Any other questions? Yeah. Or then see, nowadays because of the summers, you will get a lot of cases of vertigo. You get a lot of cases of vertigo, and sometimes vertigo becomes a very irritating disease to treat. And as in Nagpur, our basically temperatures are very high, 45 degrees Celsius. Now we have cod liver oil, basically in 30 potency and repetitions. I use cod liver oil, oleum jack. So I was talking about vertigo, So if there is a case of vertigo, and every time natrum mur, natrum carb, belladonna, glonine, don't give without asking few symptoms, If you have vertigo, then always make sure that you see why is the vertigo, how is the vertigo, is it because of the sun, is it because of lot of exposure? This is very important, Okay, just a minute. We have a question. Hello, Dr. Sharon. Stitching pain in left tonsil since 5 days, dry cough, aggravation while talking and while sleeping, tickling in throat, aggravation cough, or burning redness. Yeah, so this is a very interesting question. I suppose a lot of doctors will give a good answer. So I ask all the doctors, can you prescribe the medicine? First of all, can you prescribe? It's a case where you should think left tonsils. So we basically are looking at a remedy which is of left sided, and how is the cough? The cough is dry. If you have dry cough, this type of complaints, what do we think about? Anybody? टॉकिंग. सो इतना टॉकिंग के तो वो पेशेंट बात भी नहीं कर सकता ना, इतना ज़्यादा टॉकिंग रहता है कि पेशेंट बात भी नहीं कर सकता है. सो हमको 4-5 दवाई बहुत इंपॉर्टेंट है. देयर आर 4-5 रेमेडीज विच आर वेरी वेरी इंपॉर्टेंट. लेफ्ट साइडेड ड्राई कफ, द कफ इज सो बैड दैट द पेशेंट कैन नॉट स्पीक. Do think about 3-4 remedies, Dr. Vaishnav. First is Rumex crispus. Second you must think about Moxol. Third, think about Cupermed. And fourth, think about lachesis. If you see generalized, if the patient is unable to speak while talking, इतना ज़्यादा कफ के बोल भी नहीं सकता है, ये 4 रेमेडी सोच लीजिए. लेकिन पेशेंट बोलता है कि मुझे आई कफ एंड if I talk long, then the cough starts. Then you may have a lot of remedy. You can add bryonia, you can add silicia, you can add arsenic, you can add phosphorus also. But if the patient tells you the cough is so much that I cannot speak, then 4 remedies are very very important. Rumex, lachesis, what I told you is Rumex, lachesis, and phosphorus is again very important. Inability to speak, the cough is so much. Rumex, lachesis, Moxol, and Cuper metallicum. If you remember one case which I presented in my, I think, Facebook or one of the Google, the patient had so much cough. The patient had so much cough, admitted in the hospital, done all the tests, but did not respond to any treatment. Cupermed, a single dose, gave relief to the patient, not repeated for the past, I think, 1 year. The patient is still in follow-up with me. So that is Cuper metallicum. So inability to speak. Okay. I hope you got the answer, Dr. Vaishnav. Next question. because you will get a lot of symptoms of cough, in this type of season, like when the patient, there's a lot of heat and the patient is drinking a lot of cold water, cold juices, fruit juices, and then he starts getting cough. So these are the very, very important remedies that you should think about in your practice. Cough after cough after long talking. So you can take just one symptom that the patient is having dry cough and cough is aggravated on talking. So then there are a lot of remedies. But as Dr. Brian, you can add Brian also, and बहुत देर तक बात करता है, तो you can have these remedies also. Like then you have to understand when the patient has cough and while talking, so how is the cough? It is hurting the throat, and that pain is going out in the ear or out or anywhere. The radiating pain is very important, or it is painful cough. But while talking, generally you can have a lot of remedies, as people have told you. One of the very important remedies that I have used in my practice, you can write alumina, drosera, hyoscyamus, rumex, and mephitis. These are the remedy. Well, talking, the cough aggravates. If the patient tells you that whenever I'm shouting or I'm talking loud and then the cough aggravates, then you have to think of only one remedy, and that I have used in my practice. Of course, there may be a lot of remedies, but when the patient says that whenever the patient is talking loud, think about coccus cacti. Mercado flavus, yeah. You can think that also. But these are the remedies which I have generally used in my practice and have given me very good results. Again, alumina, ambrosia, drosera, hyoscyamus, mephitis, rumex, loud talking, coccus cacti. I think that's a sufficient answer, and you can get results of one of the remedy prescribed, what I have told you. So can we go further? Yeah, thank you. And whenever you prescribe, Dr. Vaishnav, and if you get results, do share what you have prescribed and do tell us what remedy importance you have given, so that everybody can learn. And do ask 1 or 2 symptoms of that remedy to confirm that remedy. Okay, I'm telling you 4-5 remedies which I have seen in my practice and read in my Medicus. But if you prescribe one of the remedies, do tell some symptoms which you have taken for prescription and you have got results. So clinical is very important. There are things which are written in the Mater-Medica repertory organ, everywhere everything is written. But clinically verified is very important. So do write your clinical experience, whatever you've gone through whenever I'm teaching you in my YouTube. So do share your clinical experience also. Yes, so can we go further? See, there is a lot of, so cough aggravated in the morning, also bursting from sweets, dry cough continuously followed by vomiting, and face becomes red. Yeah, so this is again cough, very, very important. And the cough, specifically if you write that cough ends in vomiting, that means there's a lot of spasm in the chest. If there is a spasm, when the what do you call, the muscles go in spasm, and that's why there is a vomiting. And this is again a very, very important symptom, a very, very important cough symptoms. Whatever symptoms you have written, you have written the whole case, beautiful case, that cough is dry, aggravation morning, followed by vomiting with redness of face. Okay. Now in this case, of course, the first remedy that everybody should think about is belladonna. But 4 remedies that you should think about in this symptom: belladonna first, second is nux vomica, third is kali carb, fourth is ipecac, and fifth is corallium rubrum. These 5 remedies are very, very important. I would say first grade remedies which I use in my practice. If they don't give result, do think about then drosera, cuprum metallicum, and carboveg. So these are the cough Mater-Medica. If you have seen my YouTube channel, it goes by the name Dr. Abdequaem's Grace Healing Homeopathy. I have basically given a lot of symptoms and of lot of cough remedies. If you go through that video of cough, every time you go to that video, you get some new thoughts about that remedy. So do go through that video of cough, what I have told in my YouTube videos, and you will get a lot of information about common remedies also and rare remedies also. I hope you hear that. How to treat repetitive cough, patient says that उसको ठसका लग गया है. हाँ, ठसका लग गया मतलब इसके दो तीन मतलब होते मालूम कि एक बार पेशेंट ने खांसना शुरू किया, एक बार ठसका आ गया तो वो खांसते ही रहता है. सो दिस इज वेरी इंपॉर्टेंट. एक बार ठसका लग गया मीन्स कफ विच इज एग्रेवेटेड बाय कफ, कफ विच इज एग्रेवेटेड बाय कफिंग, यू कैन से. अ वेरी वेरी इंपॉर्टेंट इंडिकेशन. आप समझ रहे मैं क्या बोलना चाह रहा हूं. एक बार ठसका लगा कि खांसते रहता फिर वो. Cough which is aggravated by coughing, the first remedy you should think about is ignitia. Second, write down thyroidinum. And third, Sticta pulmonale. When the patient says that the cough is so much कि एक बार उसको ठसका लग रहा है वो खांसते ही रहता है. Okay, so this is the meaning of that thing. Now one thing also is there that some patient comes and tells you that the patient is coughing constantly. He is coughing constantly. खांसते रहता रुकता ही नहीं. Now this is again a very very important indication of few remedies, and these remedies is a first remedy which I would like to tell you is Illumina. Illumina is a remedy, such a fantastic remedy, very interesting remedy. Cough is continuous in persons or in constitutions which are deficient in animal heat, that is the importance of cough symptom in Illumina. Irritating cough, मतलब patient बोलेगा कि मैं, the patient tells you कि I went to my friend's house, I ate some food, the food was nice but there was lot of salt in the food, मुझे लगा, I think that because of that I am coughing more. So irritating things like salt, irritating things like pepper, irritating things like vinegar immediately produces cough. My dear doctors, always think about remedy that is Illumina. I don't know you have used Illumina not for cough, but this is a very very important remedy when any irritating thing causes cough. Second remedy you should think about is causticum. Causticum में rawness and soreness of throat, sometimes it becomes difficult to understand whether it is causticum, whether it is nitric acid, whether it is Hiparsulf, whether it is Phytolica. So think beyond. Cough, soreness in the chest, inability to expectorate, and the sputa must be swallowed. डॉक्टर साहब मैं खांसता और मैं कफ पूरा अंदर ले लेता हूं, निकाल नहीं सकता, छाती में दर्द करता है. Causticum, very similar to Kalika, but in causticum it is relieved by swallowing cold water. And causticum में if there is expectoration, it is mostly in the night. That is the importance of causticum in our mathematics in relation to cough. Again, constant cough, you must have not used this remedy, and that is China. I'll just describe 2 or 3 remedies. China. Now China again is a very very important remedy, and of course China is a very very important remedy. Basically we use this remedy when in case of malarial fevers or any other complaints, but again China cough is very very important. As I told you about causticum, as I told you about Illumina, now China. Whenever you want to prescribe, again China has a cough which is very very continuous, but in China, every motion excites palpitation and takes his breath. थोड़ा भी पेशेंट चलता है, थोड़ा भी बोलता है तो इतना ज्यादा उसको palpitation होता है, उसके ब्रेथ चले जाता है. And the chest is painfully very sore. This is an important symptom, and as you go further in China, the paroxysm of cough is after eating or laughing is important in China. And in China, because of that, because a lot of suffocation and cough, the patient wants to be fanned. लेकिन फैनिंग भी कैसा, देखिए ऐसा रहता है. अगर आपके पास कोई किताब है, मेरे पास नहीं है, इधर तो चाइना विल लाइक दिस. फॉर एग्जाम्पल, चाइना ऐसे नहीं करेंगे, धीरे धीरे स्लोली. The China patient wants to be fanned, but not too hard, because if the patient has a lot of fanning, it takes away the breath of China. That is the importance of China cough. I hope you understood. I'll not tell you whole mathematics of the cough symptom, but these 3-4 remedies, are very, very important. Alumina, causticum, China. Then you can think about Rumex, Lycopodium, Hyoscyamus, arsenic, cuprum, ferrum, ipecac, lacasis, leccan. But how to differentiate this cough remedies is so very important, that is China. Dr. Manoj Qualikuya, thank you, doctor. I hope you understood something about cough. Cough is such an important thing to cure, because that improves your practice. That improves your practice, because if you are seeing the patient coughing, see what does it do in cough, and you get the remedy. This is so important to treat cough. If you can treat cough, and then whenever the patient comes for acute complaints, he is very sure that the doctor can cure me. Gradually, you start increasing your practice. So it's important to hear and understand cough also. So let us go further. Mouth ulcers after prescribing medicine is good sign or bad sign? See, mouth ulcers, it depends which type of ulcers, and it depends which disease you have cured. If I'll give a basic answer. If you are treating a syphilitic disease and if you're getting a psychosis or a psoric symptom, it is good. If you are treating a psoric disease, but if you get psychotic and syphilitic symptom, it is bad. How are the ulcers? Just plain psoric ulcers? Okay. If the ulcers are cracked and a lot of pus discharge and painful, psychotic, bad. If the ulcers are very painful, discharge of blood is there, the patient cannot eat anything, syphilitic ulcers, very bad. So it depends upon which type of ulcers and which type of disease you have been treating. So just understand miasms and make your choice of cure according to the miasms. Cough starts from abdomen. Now see, whenever the patient says, whenever the patient says that मुझे ऐसा लगता है, I feel that the cough is coming from the abdomen, then Dr. Patel, you have to think about 3 remedies which I have found very, very useful in my practice. I'm telling you about the clinical symptoms. The first remedy you should always think about, every doctor should think about, is Drosera. The name is Drosera rotundifolia, where the patient feels that मुझे लगता है कि मेरे खांसी पेट से the cough is coming from the abdomen. The second remedy, Bryonia alba. Third remedy, phosphorus. Fourth remedy, Antim crude. So these are the 3-4 remedies which are very, very important. The patient says that the cough comes from the abdomen. Drosera, Bryonia, Antim crude, and phosphorus. Of course, there are other remedies also. There may be a lot of remedies in the repertoire, but these 4 remedies, very useful. I have seen lots in my practice and has given me very good results. A short note in Drosera, I would just like to add one thing. See, everybody knows that Drosera is a very fantastic remedy for cough and it cures almost every symptom of cough is written in Drosera, But you have to understand and see that Drosera cough is a very, very important symptom, Whenever a Drosera patient says that my cough is coming from the abdomen, itna zyada cough, the cough is so much that it takes away the breath. That is a symptom of Drosera. And because of that, it compels the patient to hold the sides, followed by a lot of retching and vomiting of whatever is eaten. And then there is a lot of cold sweats. That is Drosera cough. And Drosera, the voice is so deep and hoarse, it requires a lot of exertion to speak. You must have seen a lot of cases, that where the patient speaks so loudly, jam se baat karta, Drosera cough. This is a very, very important indication of Drosera. Of course, you must have seen you must have prescribed Drosera, but this is very, very important. We have seen in a practice, Drosera. I hope you got something about cough, and I know everybody will cure cough one day or the other, but do remember sharing your experience of remedies, Mishra ji, a patient feels antagonism herself because of eczema. Remedies. Antagonism of self. No, see, antagonism, Mishra ji, एक ऐसा रूब्रिक है जो मतलब अलग प्रकार का रूब्रिक है एंटागोनिज्म. आप क्या बोलना चाह रहे हैं? रूब्रिक समझोगे? क्या समझाओ? मतलब एंटागोनिज्म, सबसे पहले आप हमको उसका मतलब समझना पड़ेगा, व्हाट इज द मीनिंग ऑफ एंटागोनिज्म। तो आप रूब्रिक का मीनिंग पूछ रहे, एंटागोनिज्म मतलब या आप बताइए क्या पूछ रहे हैं? मतलब किसी के अगेंस्ट में, एंटागोनिज्म किसी के अगेंस्ट में स्ट्रॉन्ग, हाँ किसी का अगेंस्ट एंटागोनिस्ट, इज एन एंटागोनिस्ट। सो अपने अपने अपन चाह रहे कुछ और कर रहे कुछ। बनना था एमबीबीएस डॉक्टर लेकिन परसेंटेज नहीं आया तो होम्योपैथी डॉक्टर बन रहे हैं, एंटागोनिज्म। विल के अगेंस्ट काम करना है। अगर विल के अगेंस्ट काम करना है तो हमने एक रेमेडी आपको बताई है, जो पहले भी बताया अभी बताते हैं हम, एंड दैट रेमेडी सबको पता है, जो एलेंस की नोट में या कोई भी मैथमेटिका में बिल्कुल 3 मार्किंग में लिखी हुई है। हम उसके सिम्टम बताएंगे, आप रेमेडी बताइए। ओके, कौन सी रेमेडी है? कौन सी रेमेडी जो हर एक डॉक्टर को याद होनी चाहिए, बोलो। मैं सिम्टम बताता हूं। फील्स दैट ही हैज 2 विल्स, one condemning him to do what the others forbids. Which remedy? Yes, I'll come back. मैं मिश्रा जी का एक बार आंसर दे दूं। वो रेमेडी में लिखा हुआ एनाकार्डियम। वेरी गुड डॉक्टर नितिन, एनाकार्डियम। एनाकार्डियम सबको याद रहता है। हम बताएंगे उसके आगे के रेमेडीज। सबसे इंपॉर्टेंट रेमेडी हमने बताया था आपको, कालिकार्ब, कालिकार्ब, लैकेसिस, सीपिया, सिलिशिया। अब एक एग्जांपल देता हूं, सीपिया के अंदर लिखा हुआ है, या एनाकार्डियम एवरीबॉडी है, सीपिया में एंटागोनिज्म क्यों है? बिकॉज सीपिया हमेशा किसी के डोमिनेंस में रहता है। सीपिया लाइक्स डांसिंग, मतलब किसी की हाथ की कठपुतली, शी बिकम्स लाइक अ टॉय। कठपुतली किसी हाथ में डांस करने की, करना कुछ और है, कर कुछ और रही है, दैट इज सीपिया। कालिकार्ब, I told you, elements from or easy disposition to overlifting. He always stretches himself for work. He works so much to complete the work. If he does not like also, that is Kalikarb. So antagonism के अंदर think about anacardium, think about Kalikarb, think about sepia, and think about lachesis also. Everybody has given the answer anacardium, that everybody knows, but these 3-4 remedies I have seen. In fact, if I go further in my clinical practice, I have seen results better in remedies like Kalikarb, Cilicia, Lachesis, much better than anacardium. इतना मुझे भरोसा है सब रेमेडीज पे। सो कभी कभी हमारा क्लिनिकल एक्सपीरियंस कुछ अलग बोलता है और सिम्टम रेमेडीज में अलग रहती है। सो मेरा एक्सपीरियंस बता रहा हूँ, ये कालिकार्ब और ये सीपिया और ये लैकेसिस, ये सिलिशिया बहुत अच्छी काम करती है एंटागोनिज्म के अंदर। ओके, सो एक बार हम देखते हैं दूसरा, वन मोर रेमेडी, जस्टिशिया। नाउ whenever you are prescribing justicia, justicia is such a fantastic remedy. उसका फुल नेम क्या है? जस्टिशिया आधा तोड़ा, जस्टिशिया आधा तोड़ा। ओके, सो जस्टिशिया, now see, justicia is such a common medicine that it is said that if you don't understand anything, just give justicia and it will start curing the patient. And frankly speaking, if you don't understand anything, you can give justicia mother tincture. It acts physiologically also, and एक आयुर्वेदिक में दवाई है अडुल्सा, उसके अंदर भी जस्टिशिया ही रहता है। सो जस्टिशिया इज अ रेमेडी फॉर अक्यूट कठारल कंडीशन ऑफ द रेस्पिरेटरी ट्रैक्ट। मीन्स देर इज कफ, देर इज टाइटनेस ऑफ द चेस्ट, there is lot of rattling, obstruction, and obstruction of breathing, and lot of sneezing. Whenever there is lot of sneezing, जब भी patient says that मुझे एक साथ में इतनी, there is one time there is so much sneezing and lacrimation from the eyes, and there is loss of smell and loss of taste, you must think about justicia. And if the patient comes after 2 or 3 days, the sneezing is better, the lacrimation is better, expectoration of justicia is very tough, it is very thick, it is very stringy, it is very tenacious, very stiff. That is the most important indication of justicia which I have seen in my practice. I hope you got the answer. Who was up the question? Justicia? Dr. Patel. I hope you got the answer about justicia, so that it's a very, very important remedy. And as we go further, so somebody had asked me something about varicose vein in females. See, varicose vein, male, female, both we have, but in varicose vein, do ask the lady that if she has taken a lot of contraceptive pills, in India, there are a lot of ladies because of some rituals or because something they take a lot of contraceptive pills, and if she has seen the side effects of contraceptive pills, one of the side effects is thrombophlebitis, varicose vein. So do ask the patient that. And remedies for coryza with lacrimation, yeah, it is there. It is written in a mathematica, fits of sneezing with lacrimation. Fits एक के साथ में fits of sneezing with lacrimation, yeah, 30 potency you can give in repetition, you can give that. So varicose vein, I hope you understood the cause. Now maybe long standing is also cause of varicose vein. So if you're treating a case of varicose vein, make sure that the lady has not taken contraceptive pills, or if she's taking that pills for increasing the menstruation or getting it further, a lot of progesterone, estrogen, stop that. Second, lot of standing, because once the blood goes on, it does not come up because there are no wall systems. So it is important to tell the patient wear stockings and elevated the legs. Remedies, as far as you go, the remedies are very simple. Like you can think about hemimyllis, carboveg, floric acid, pulsatilla, arnica. These are generalized remedy, 3 marking tips. Then you have to ask the patient very specific symptom like varicose vein and the plethora is blue. In that case, carboveg and pulsatilla works very well. There is a lot of burning. Think about arsenic. There is a lot of congestion in the veins. Think about millefolium. Kabhi kabhi, sometime happen, there are a lot of network of veins. On the skin, there's a lot of network of veins. Then think about crotalus horridus, lachesis, hemimyllis, and pulsatilla. And sometimes what happens, there is a lot of veins and you touch the vein, there is a lot of pain. So there is a lot of soreness, Then think about hemimyllis or phosphorus or naxomic or kalikarp. And then you have to think that which type of pain, stitching pain, stinging pain, or then you have to differentiate, and sometimes if you have specifically asked me question for ladies, then you have to think varicose vein during pregnancy. So if you see a pregnant lady having varicose vein because of obesity or because of other cause, you must think about 3-4 remedies which are very useful. First on my list would be ferrum metallicum, second pulsatilla, third lachesis, fourth graphitis, and of course hemimyllis. Hemimyllis always comes in varicose vein because it's a very interesting remedy. So this is how the therapeutics of varicose vein, which you have to look in your practice and see and define that symptom of varicose vein so that you can differentiate remedies and prescribe. I hope I could answer your question of varicose vein. Can we have some more questions? It is 3:53. We still have about, I can still answer some questions. CPR. I had to actually prescribe some, I had to give one answer of a remedy. If that, I don't know the doctor is there or not, but still I would basically give that answer. So one doctor had asked me something to tell about Brata sulf, Now, Brata sulf, whenever you are thinking about Brata sulf, so you must have the basic experience of Brata. Then you can think about Brata sulf or Brata carb or Brata fluor, Brata mur, Brata nitricum, and Brata phos, Brata silicata. There are a lot of Bratas, First important indications of Brata sulf, you must think about mind. There's a lot of timidity and there is no confidence in the patient. That is Brata sulf. Means the concentration of mind is almost impossible. That is, Kent writes beautifully about Brata sulf, that the concentration of mind is absolutely negligible or zero. That is Brata sulf. And Dr. Kent writes that desires for open air which ameliorates. And he also writes that desires things which are not needed. Desires things which are not needed and soon put aside. Because the patient is very much critical, Brata sulf. So these are the very important indications of Brata self, because whenever you're prescribing these type of remedies, you have to understand. Or a Brata self patient basically is a patient who has a lot of theorizing, always in a hurry, and he is very much devastated by rejection. A Brata self patient cannot relax because there is a lot of activity in the mind. That is Brata self. And Brata self, I had cured a simple case of corns, where the corns are very sore, a lot of burning is, and they're very painful. Of course, then the timidity part and the rejection part was there in the patient, but simple cane of corn also was treated by Brata self. So this is something about Brata self, like their very clumsiness is there, the muscle coordination is very poor. Those things are about Brata self. I'll come back to the question. Calcarea floor, cardosmar, hemlock, but I failed to cure. If you have failed to cure, that means you must have not asked a very specific symptom in relation to varicose vein. Varicose vein basically sometimes becomes an occupational disease, especially the persons who have a standing job, like lawyers, like surgeons, like those persons who have a standing job continuously. In this case, basically, then what you can do, you can only prevent the progress of disease. So it's a constitutional problem. Then do think about the constitutional remedy, because these hemorrhages and all depends upon the symptom wise. It is very pulsating pain, it is reddish in color, or it is painful, better by. So these are the very important remedies. Arnica and swell. So it may be not indicated. So there are other things of varicose vein. Sometimes ask the patient to at least wear crepe bandage, at least elevate the leg and sleep. It is very important to give the auxiliary treatment also, but because just by giving medicine the veins will be better, the chances are very less. So if the patient is healthy, there is no other problem, just because of standing is a problem, then basically it's an occupational problem. Like if a person is drinking chilled water, chilled beer, chilled everything, and he gets a lot of recurrent cough and cold or asthma, we have to ask the patient to stop this cold food and cold drinks. Then only he can start getting better. In the same way, varicose vein in healthy person is because of what you call hanging the legs or standing on the legs for a long time, and then ask the patient to do some auxiliary measures, and then they give a constitutional prescription, then you'll be able to cure that. Yeah. So if it is not calcarea for cardosmar, I have never used in my practice for varicose vein. So in this case, then you think about some other remedies which I told you. Varicose vein, like you think about carbo-wise, you can think about calcarea carb, you can think about sepia, you can think about natrum mur, you can think about gastritis. These are other remedies than China and ferrum, depending on the patient's constitution. Acidity, weakness, and vomiting. See, acidity, weakness, and vomiting because of emptiness of stomach or because of fasting. Again, simple. If you just want to, if the patient only tells that because of only this condition, fasting condition, he's getting that vomiting feeling or XYZ feeling, then see, there are few remedies which are very important. The remedies are graphitis, Brata carb, calcarea carb, petroleum. Fasting, aggravation, or fasting while the patient has this symptom. But I would say if the patient is only telling you that because of these complaints there is fasting, just give the patient a lot of fluids, and remedy should not be given because it becomes a psoric symptom, because of course the patient is fasting, so he'll have that retching, gagging, vomiting would be there. Just tell the patient to get rest, because if the water content is low, then there will be a lot of spasms in the muscles in this intestine because of loss of water. So you can get pain, cramping, and all. So this is because of a lot of water. Tell the patient if the fasting is over, drink a lot of water and a lot of fluids and all. Automatically he would get better. If I was given the case, I would have just given plain placebo and tell the patient to have a lot of fluids to basically treat the dehydration and to get the osmosis right in your abdomen. So I think it's now 4 o'clock, and we should now conclude our session. It's already 4 o'clock. I hope you could get some answers to your queries, and if you do get results, get back to me and we'll share your results. So Any specific medicines for molluscum contagiosum? Yeah, specific medicines for molluscum contagiosum. I will not give you some big answers. You do think about thuja, think about silicea, think about Azadirachta indica, think about Ignitia, and think about silicea. 4 5 remedies sometimes becomes very useful in practice. Of course, if it does not get, then we have the whole philosophy, that get the whole case and all. But these 5 remedies will work very nice in most of the cases. So, thank you everybody. Thank you for joining. Meet you in the next YouTube live. Thank you so much.